All right. Well, welcome everybody. I'm glad that you could be here tonight. This is module 10. This is actually the last of the webinars that you'll be required to be involved in. And as we sent you in that email, the module 10 assignment is somewhat different than what we're used to doing. There's an extra part to it, and I will share more about that at the end of the webinar. But I think, especially for all of you, I hope that some of this information, and some of it you may already know, is helpful for you, because it does have to do with communicating with clients during the end of life situations, okay? So let's go ahead and get started with that and talk about what are our goals for today. First of all, we're going to start off talking about the importance of effective communication. And part of that is understanding how to deal with that anticipatory bereavement client, how to talk to clients during end of life situations, and even during the euthanasia. And then, of course, for us, what's really important is following up and pet loss support. So let's start with the benefits of effective communication. And like I said in the email, it's no coincidence that we put this module right after compassion fatigue. I'm one that believes that communication plays a major factor in compassion fatigue. And the better we're able to communicate with our team, with our clients, and even with ourselves, the more able we're to manage the effects of compassion fatigue. So let's start off talking about what are the benefits of effective communication for the client. And if you notice, if you look at all these statements, every one of these statements, so the second word starts with feels, right? Because when we're dealing with clients at end of life, really scary time, how they feel really matters. They need to feel like they're heard. They definitely want to feel like people care about them. They want to feel confident with their veterinary team. And hopefully they want to feel a little bit stressed out, a little bit less stressed. Sorry, I actually,
Or stressed out.
yeah,
I think you're stressed out.
yes, I am stressed out, and I will, a little bit of personal disclosure here. I just got back from a situation I'm having with my cat, and it's not even end of life, and it's kind of like a new vet, and I'm dealing with all these decisions. And I wish I would feel calmer than I do right now, and a little bit more confident in what's happening. It's very important, because when clients feel this way, you're going to be able to communicate with them more effectively. What about the benefits for the pet parent? Well, or for the patient, sorry. The patient obviously gets the best care when there's effective communication, because the pet parents are able to share what's going on, right? That leads hopefully to the best outcome, and hopefully it leads to the patient feeling a little less stressed as well. But then you also have, what are the benefits for the veterinary practice? And effective communication within the practice is very, very important. Listen, bottom line, a practice is a business. They need to have customers and clients. And studies have shown, and I did attach the end of life study that we did, but a lot of studies show that the end of life experience plays a big part in whether clients are going to return to a specific practice. if the experience wasn't good, they're probably not going to return. And especially with social media today, they are going to tell as many people as possible how horrible it was. We often tell veterinary professionals that last impression at the vet's often lasts forever. So work to make it as peaceful as possible. Veterinary staff should have the communication tools they need to be the best they can be, both for their patients, their clients, for each other, and for themselves. They have to be able to communicate well so that the team can offer the best services for the pets and their family. If they don't, that's when you're going to look forward to the higher turnover, the compassion fatigue, the burnout. If they're battling each other, not working together, it's going to be a downfall. Having a compassionate practice should be the goal of every hospital and clinic. I just mentioned that compassionate practice, and while we don't have a lot of time to go into the details today, compassionate practice is something that Pet Loss Partners developed, and we often do a series of webinars for different veterinary practices. Basically, we call compassionate practice one where everybody, the doctors, the staff, the clients, all feel cared about and seen and heard. What happens when that happens, when everybody feels cared about? You're going to get the best care. Clients are going to get the best care. What happens when the clients get the best care? Then they're nicer, right, to the staff. They're feeling more confident. And what happens when the staff feels good about what they're doing? They're good to their team, they're good to the patients, they're good to their clients. Everybody benefits. The practice benefits. The compassionate practice is based on 4 principles of communication, open communication, open communication, compassion, resilience, and the total experience. If you are learning more, if you're interested in learning more about the compassionate practice, don't hesitate to reach out. I'd be glad to share more information about that with you. So as I said, we're going to spend some time talking about this anticipatory bereavement client. And I'm going to take off for a moment my instructor hat and even my pet loss specialist hat. And I'm going to talk to you as a pet mom talking about Maz. And I think I mentioned Maz in one of the other webinars, but he was my 17-year-old beautiful blue-eyed Siamese. That's him on the upper right-hand corner there. He was with me through so much of my life, grad school, the end of a long-term relationship, the loss of both my mom and dad within a 4-year period. And at 17 years old, he was basically dealing with normal age-related senior cat ailments like hyperthyroidism, kidney disease, losing some weight. But one day I noticed that one of those beautiful blue eyes had turned green. And while we initially thought it was a eye infection, when the medicine didn't work, I was sent over to a veterinary hospital. And I have to share with you, I always had this feeling with Maz that he was going to live to be 18, 19, even 20, because he was always in such good health and he was my everything. That was the script I wrote for myself, that one day I would just wake up and he'd be gone. You know, he would have passed away in his sleep, right? Doesn't everybody kind of hope for that? So when I went to this big emergency hospital and they did some tests and they told me, well, he's got lymphoma, I was like, no, he doesn't. He has an eye infection. And they started to go over all this with me. And luckily, a friend of mine had come with me because To be honest, it was almost, and I'm probably aging myself here. I don't know if any of you have seen any of the old Charlie Brown movies that used to be on, where they would be in the classroom and they would have the teacher and it would be like, wow, 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 wow. It would never show any of her words. They would just have that wow, wow thing. And that's how I felt like when the doctor was talking to me. I don't honestly remember hearing anything he said. Like I said, luckily my friend was with me. But that's what happens a lot of times with pet parents that are just dealt this blow. Even when we know our pets are older, or even when we've been told that they're dealing with kidney disease, with high blood pressure, with whatever it is, we somehow don't really think that it's ever really going to get the best of them. We think they're going to beat it. And so when something bad happens, it's just like, well, what just happened? This isn't, it's like that script of what you thought got, torn to shreds and thrown all over the place. But a lot of times what you deal with clients going through the anticipatory bereavement phase is confusion. Again, I will share with you that I was offered palliative care, or I was offered the opportunity to have Maz's eye removed and then followed up with some light chemotherapy. And I honestly think in that there was about 2 or 3 weeks before we finally did the surgery. I must have gone back and forth in that 2 or 3 weeks at least 10, 12 times. First, I would be like, yes, yes, I want the surgery. Then my friends would say, are you sure you want to put him through that? And I would call back and say, no, cancel the surgery. We'll do palliative care. And then I would feel like I wasn't doing enough. And I would call back again and say, I want to do the surgery. I want to try everything. I was emailing this poor veterinary oncologist at least every other day, and bless his heart, he was so kind to answer all my questions. He would tell me something and I wouldn't even remember what he said. I would ask him, like it says here, can you explain that again to me? I would change my mind. It's so normal with clients going through this. You've probably heard that term, shoot the messenger. A lot of times that happens. We talked about how it's easier to be angry than to be sad. And it's like when something happens, you want to blame somebody because you have to have that cause and effect. Well, what made it happen? And unfortunately, a lot of times what happens is that blame goes on the veterinary team. Not justly, but it does. We pet parents ask themselves, how could that have happened? Here, sure, if she was fine a couple of weeks ago, something must have caused this. You didn't tell me about this. You didn't tell me I should do that. And I often share with my veterinary clients who I work with, and I will say to them something that I learned, which is, if it's really not about you, if the blame isn't about you, why do we react as if it was? If we could remember that these are just clients who are scared, who are sad, who are trying to figure out what to do, sometimes it can make it easier on ourselves too. It's not always easy to do, but it's important to keep in mind and at least try. Another thing that happens is that fear turns into panic, right? It's just like clients start acting irrationally. They'll lash out. What used to be their normal standard operating procedure, the way they lived with their pets, all of a sudden, like I said, that script is thrown to the garbage. And now they're having to deal with something that is very, very scary. So trying again to remember that it's not about you, it's about their fear, their anger. It really can make a difference in trying to communicate with them at that time. A lot of times what'll happen too is that fear turns into like a micromanage. They think, well, they've worked this hard to get their pets to this age, or their pets have been healthy up to now. And they've done it by controlling every little piece. When they go out for a walk, what they eat, when they go to their vet visits, who they're around. So maybe if they can continue to control everything, so they start asking tons of questions, they start questioning your knowledge. It's like they have to be in control because they think if they're in control, it's going to make it easier for them. But a lot of times, just letting them know and just saying, you know what? Here's the situation that we're dealing with. I'm going to do everything possible to help you at this time, to help Fluffy at this time, and let's work together. Let's talk, let's work together to make sure that Fluffy can get the best care possible. I know I always pick on poor Fluffy, but that's who came to my mind at the moment. And then, of course, like I said, it's the anger. Fear and sadness often will manifest itself as anger. Not only angry at you, but they're angry at themselves. How did they miss it? If they're somewhat spiritual, maybe they're angry at God. Maybe they're angry at their pet sitter. It's a lot easier to be angry than it is to be sad. So before we continue on to keys to effective communication, I just want to stop real quick and just see if there's any questions, if maybe you've had an experience with a tough client.
No questions, but it is definitely ringing true for me, because there are a number of times where, especially the confusion is almost always present. But I do have, this is very, very relevant because I have, tomorrow I have a euthanasia for a pet that's pretty long time coming. I had to have a nice long, or I did have a nice long discussion with the owner this morning on the phone. We're circling around the anticipatory, or she's in anticipatory bereavement, I should say,
Yeah.
and circling around these ideas. And luckily, she's very grounded. She doesn't go towards the anger portion of it. She did have a little bit of panic and no blame at all, which was great. Tiny bit of the micromanage, just wanting to know exactly what was going on. What was really interesting, I thought, and it really made my heart fill to know that we've been working on these skills, so that I was saying the right things, I was being self-aware, and it was making sure to say the right things and be empathetic. And she thanked me for that, but then she said, I'm going to ask you to not be so empathetic and actually scare me right now, because I need to know I'm making the right choice. If I don't make this choice, what is the worst thing that can happen? Because I never would say that, right? I would never
Yeah.
try to scare somebody. So it felt so good to have somebody recognize what I was doing, but also tell me how they wanted to be communicated with. And that was a new one for me, and I loved it. Was able to go for it. And I do have another client who is actually, she's actually a therapist, and a grief specialist who is in the anticipatory bereavement, and we will be euthanizing her cat soon. And I think this is the most timely conversation for me personally, because I I I I'm a little bit I don't want to say nervous, but it's to know to deal with somebody on that side of things, dealing with individuals of your capacity to the know grief and grief counseling and dealing, um, is a little bit intimidating.
Yeah, and I'm gonna ask Connie to comment on this too, but I'll add in a few things. And I'm so glad that some of what we shared with you has been helpful and that you can kind of stay aware. And here's the thing, Jess, right? Is that again, every person, again, I'm on year like almost going on year 16 now. I'm on year 15 doing this. And I think Connie would agree, right? I could honestly say I've never had two clients go through this exactly the same way.
Mhm.
It's so individual. And the fact that she she needs to be told, okay, I just need to be sure I'm making that, and she needs you to tell her that, right? And not, I guess to me that is being empathetic by telling her that, but she needs a little bit more of the medical part of it.
Right.
And you will find everybody, again, it is different.
Mhm.
Some people really, they don't want to hear that.
Right.
They just need to trust themselves more. They know what you're saying, and they've just got to trust themselves a little bit more. In terms of dealing with the therapist, with the grief specialist, and Connie and I talk about this all the time. I actually think we're the worst right, people to have to deal with, because like intellectually we know it all, but emotionally I think we're the biggest messes, right? Because we're feeling what we're feeling, and we know we should, like, there's that rational part of it, but then that heart part of it. And so a lot of times, and I have had clients who are therapists, even not grief
Oh, yeah.
specialists, right? And they're like, I understand what this is, but and like they're fighting with themselves.
Yeah.
Mm.
Oh, if we could think
Right.
it away, wouldn't that be great?
Yeah.
It would be
Yeah.
beautiful,
It's
right?
like,
Yeah.
oh, okay, get it away.
Yeah.
Oh, yeah. I mean, yeah, we're human beings and we
Mhm.
grieve too. And I'm in anticipatory bereavement for 4 dogs, and I hope we live through this. It's really hard. And and I wanted to say something about your client and also what you're doing too. What a brave thing for her to say. Is
Yeah.
Right.
I want to know, because a lot of us don't want to know. But yeah, so that's awesome that you're already starting to use some of these things you've learned. The one thing I would say with dealing with her, like other than like what Sandy said, is just be yourself.
Mm.
Just be yourself. Whenever I meet with a new client or um chat group or something, I just open my heart, and and you'll be fine. You're going to do a great job.
Yeah, and
Thanks for
you know
that.
what, just too, I mean, what Connie said is so true, right? Just listening to
Mhm.
your part, but also what I would say, and Connie, please feel free to add on to this too, is like, so with the grief, specialist therapist, if she starts getting too intellectual, right, you can kind of say, I can relate to what you're doing and kind of how you're feeling. It reminds me of sometimes what we do as veterinarians, because we feel like we shouldn't, you know, feel this way because we know all the medical stuff.
Right.
You could even say, I just took this class, and even the instructors were telling us that it's really easy to get into our head, but now's the time. And I think it's okay to tell her, and kind of you could agree or disagree, like, you've got to allow yourself to feel this. Don't be
Yeah,
a therapist right now.
yeah,
Don't
yeah,
be a grief specialist. Be that pet mom and
Mhm.
allow yourself to feel this.
yeah, yeah, exactly.
That's
Exactly.
really beautiful. Thank you very
Yeah.
much.
Sure, sure.
I'm actually writing a story about being a grief uh therapist and my last loss of Jake, my heart dog.
Aw.
You know, because it's like, okay, I know how grief works. Okay, I know this is gonna happen, and I know this is gonna happen, and I know I'm gonna do this, and I'm gonna go do this, but it doesn't make it any easier.
You know?
Oh, neat, Connie. Is
That's
it like a book or more like a story that you're gonna?
I was just gonna pitch it to a magazine or something, or
Yeah,
yeah, I was just gonna see, because yeah, and actually, Jesse, almost every therapist has their own therapist.
yeah.
So
Okay, that's good to know. I imagine she does. Yes, that's really good to know.
yeah, so yeah, you're gonna be fine. And I'm so sorry for her loss. I just don't know how you guys do it. I'd be an absolute mess.
I mean, yeah, that well, and same on the reverse. But I'm in the same mindset. I don't practice on my own pets, so I'm definitely extrapolating what you are saying. As your from your professional perspective, my pets go to my friends, and I tell them to do
Yeah.
what they need to do.
Yeah.
And that is that. I'm here to love my pets, and so I understand that barrier. And so I have a vet for my cats,
Yeah.
and so it's great to know that therapists have their own therapists too. So thank you.
Sure. All right, well, let's go ahead and continue on and start talking again about the keys to communicating. Whoop. If my computer will, okay, there we go. Will agree with me. So I love this saying, and I share it with a lot of my veterinary clients because it is so true. And again, we sent you the results of that study that we did. And that study was done several years ago. But we really wanted to find out what pet parents felt going through this time and after losing a pet. And we had some close-ended questions, like rating questions, and then we had the questions where we allowed them to really share their feelings. And that's what really told the story. And one of the biggest things that came up was that clients don't care about how much you know until they really understand how much you care and that you're on their side. Once you let them know, they feel that you're on their side, so much easier to communicate with them. It helps to build that relationship. And it really is all about relationships at these difficult times. As you see there, right, it's about communicating with passion, connecting with clients. I get asked a lot when I do these workshops on communication, and there's a fear. A lot of people have talked to me about this fear. Well, if we take off our professional mask and allow our feelings to be seen, we're going to wind up being hurt at the end. And definitely that can happen. But I'll tell you, more often than not, when you're able to express your passion, your care with your clients, it makes it so much easier to be able to effectively get what needs to be done. Just again, saying something like, I am so sorry. This has to be so scary to you. And I want to work with you. I want to walk beside you on this and try to make this time easier both for your pet and for you. Saying something like that could mean so much. It helps to take down that wall on the other side. There is some work that's been done that shows that when you have to deliver bad news to a client, it's super important to have that direct eye contact. So if a client is sitting, try to find a seat next to them. You don't want to be standing above them. You may even want to say to them, if you're both standing, let's sit down. I want to go over this with you. I want to share this information. Again, it helps with that connection. And when you have that connection, everything gets a little bit easier. Talking about again that compassion. I mentioned to you the study where that one question, it said 74% of respondents said that the compassion shared with themselves and with their pet was just as important as the medical care that they received. Talking about compassion for the patient, compassion for the client, and what happens when we offer that? It's about self-compassion for ourselves too. It feels good to connect. When we take care of ourselves, when we have that effective communication, again, we start to avoid those symptoms of compassion fatigue, of burnout. I'm not sure if any of you have heard of Kristen Neff. She does some amazing work on self-compassion. She's got a website. She does some webinars. I'd really look into some of her work because it is so important for caregivers. This is really important too, about making sure that you let the client know, you know who they are, you know who their pets are. You want to always use their name, their pet's name, and be sure to use the correct pronoun. When I meet a client for the first time, I have an intake form. And on it, they do mark whether it's a male or female, their pet. I will share with you, I adopted this adorable little 3-year-old West Highland White Terrier, and her name was Scotty. And like I said, she was between 3 and 4, they told us. We tried tried thinking of names that rhyme with Scotty. There was nothing really good, so we kept her name. I can't tell you how many times we would walk into the vet, no matter how many times we saw them, or when she got groomed. Oh, how's he doing? How's little Scotty boy doing? It's like, well, I don't know about Scotty boy, but Scotty girl's doing really well. And it's like, come on, we've been here for a while. And there are a lot of gender neutral names, right? Zoe. I even heard of a female dog just recently. One of my clients lost her dog, and it was a girl, and the dog's name was Roscoe. And I kind of thought it sounded like more of a boy's name, but it is what it is. You also want to really listen to what your clients are saying, because the more you can understand about who they are, who the pet is, what their relationship is with their pet. Again, it's going to help in communicating. You're going to get a sense of, is that pet more of a support for that person, like a support dog or cat? You may want to take some notes, not really in front of them, maybe just jot down a few things. But you could fill in the details when the visit is over. But anything that's going to help you know how to deal with that client. If they say something like, I just got a divorce, so it's me and Fluffy, or if I just lost my job, right? There you're going to know they may not be able to afford a lot. So really listening to what they're saying. How do we do that? How do we talk to clients again? We've talked about this a couple of times, using open-ended questions, asking the questions regarding the pet and the client. Ask those whats. What's been happening with Scotty? Like, how has Scotty been acting at home? What have you been noticing? How have you been dealing with giving Scotty the medication? How has Scotty reacted to the medication? How are you doing with giving Scotty the medication? The more you can kind of get that open-ended, not just yes, no, the more you're going to be able to help. And then again, it's really about empathizing with them, trying to understand. More information you have, the more information you are going to be able to understand their perspective, why they're doing what they're doing, why they're not maybe listening to you the way you would hope that they would. And then you can communicate back to them. Let them know, right? The paraphrasing, that you're understanding what they're saying, that you're on that same side. I'm going to share with you now, and I'm going to do a little abbreviated version. So a lot of times, again, when I speak at a conference or when I do these webinars or talks at veterinary practices, I do get veterinary professionals coming up to me and kind of saying, I'm not really sure what to say or how to answer questions or how much to share. I don't really know how to talk to people. I don't know what they're going through. And when they say that, I always kind of say, yes, you do. You really are an expert because you've been through it. Most of you are pet parents too. And so we do this exercise that really kind of helps drill that down. And I'm going to do, again, a very abbreviated version of it. So I want you, if you're possible, to sit in a comfortable seat and kind of just take your veterinary hat off. I want you to think back to an experience with one of your pets that was going through the end of life, maybe having to make those decisions to euthanize. Now, it would be good, sometimes you can think about when you're a child, but really it would be helpful if you could remember a situation where you were at least involved in part of the decision. But I want you to think back to that experience and think about what it felt like to be going through all that. What did it feel like when you got that diagnosis? What did you need somebody to do for you, to say to you, to help you with? I want you to think about what they did right, what the team did right, what your veterinarian did right, what really helped you in going through the time. How did that feel for you when they were doing the right things, when they were saying the right things? Now, I want you to reverse that a little bit, and I want you to think about what was done wrong. What might have been said or done that now that you're a vet, you would be like, oh my God, I would never say that to a client, or I would never do that with a client. Think about, how did that make you feel? Then I want you to kind of open up your eyes and make a few notes if you can, like write down a few little words or feelings of how all that felt for you. And then just over the next few days, really take some time to think about, wow, this is what I want to do for my clients. This is what I want to say because this is what I needed. Or this is what I want to be sure never to say. This is what I want to be sure never to do. And then as you're thinking about those things, maybe try writing up some sentences and seeing how they feel for you, kind of like that mirror work that we did back in module, I think it was module 6. I think what you really, if you can really bring yourself back and remember some of these experiences, it's going to make a big difference for you in helping your clients through those difficult experiences themselves. So as much as we've been talking about the touchy-feely stuff, there is the important information that you need to get. Like I said, you want to, and I'll say this in a nice way, right? And sometimes it can be hard to remember because you've been doing this work for so long. So you have all this knowledge, and sometimes it can be hard to remember. A lot of times, maybe it's a person's first trip down the road where their pet's dying. Maybe it's a person's first dog or cat. Maybe they've always it's their first time as an adult that they've had to go through. So it was always their family or maybe a spouse that made the decisions. So they really haven't had to deal with any. That's why I suggest that you talk in what I call client ease. And when I'm talking about client ease, I'll give you an example. I had to be present at a euthanasia, and this vet tech was one who never should have been involved. It was a time where I was bringing my own pet in just for an exam, and the doctor knew that I was a pet loss specialist, and he told me that, and I was the next to the last patient of the day, and he said that the last patient of the day was this young woman who was about 30 years old, and she was having her 20-year-old cat euthanized. And he asked if I would stay and if I would talk with her. So I said, yeah. And I went in, I introduced myself, and she was very teary and kind of asked me some questions, and I told her a little bit about Mars. Well, in walks this young, bubbly vet tech. And she looks at the woman and says, okay, well, we're going to go back now and put the catheter in Charlie. And you could just see the horror in this young woman's eyes. She's like, wait, what? Where are you taking my cat? What are you doing to him? What's a catheter? Why does he need a catheter? That's what I'm talking about. It was such a difficult situation. And she didn't know. She had never been through a euthanization before. She didn't know why you're doing a catheter. She just wanted Charlie there with. What she really needed was someone to sit and explain it to her, which I did. But that's what I'm talking about, explaining the whys, explaining the whats, especially in those difficult situations. You may need to explain the progression of a disease, explain it so your client can understand it. At the same time, as much as I'm telling you to use client ease, you do want to use the proper terminology, and I'll tell you why. Because what happens is clients are going to hear something and they're going to go home, and what are they going to do? They're going to go to Dr. Google. And what does Dr. Google do? Dr. Google 9 times out of 10, kind of you feel like you're dying because it's so generalized, right? So by you using the proper terminology and then giving them resources, if they want to look it up, give them a website, give a pamphlet about the disease. I also recommend really letting your clients ask all the questions they have at that time. And the reason you want to do that is it helps them to feel more comfortable and that you care. But also it's going to avoid them walking out of the office, kind of like what I did with Maz, with calling that doctor and emailing that doctor almost every other day. It's going to avoid that. You're going to get as many questions in. Even ask them, do you have any other questions before we leave? It's going to help you. It helps them. In terms of communication, I do think that giving them all the information in terms of how to communicate with you is best. So like the doctor who operated on Mott's, I was calling him, like I said, every other day. And finally, he told this nurse, tell her to email me and tell her to email me in the morning, because I look at my emails first thing in the morning and I can send more information to her that way. So let them know if you have any questions, should they call? Should they email? What's the best time to reach you? Is it in the morning? Is it in the evening? What about if you're not around? If you're not a 24/7 vet, what do they do if there's an emergency? Who should they call? And what about following up, right? When should they follow up with you? What should they be concerned with? When should they call if there's something they think is a problem? How do they know if it's a problem? Again, the more information you could provide them with, it's going to allow them to feel better. And it's going to help you too, because they're not always going to be reaching out at times that you may not be able to get to them. That's why we talk about what I call the common goal. And I really do think that when you are able to reach that common goal with your clients, it makes it so much easier. Here's what can happen. You can have a client that will come to you with a dog with a very serious illness, and they may have some very limited funds. So your idea is you look at the dog and you say, geez, we could put him on this medication. There's this treatment. We can do these tests. Maybe there's even an operation that we can do. And you may have no idea that they have some real financial constraints. So you're going to start rattling off all these options to them. And what happens then? Well, a lot of times the client can start to feel really bad. Number one, they could feel really bad about themselves because they don't have the money to do these things. And they don't know how to tell you. So maybe they'll never see you again. They may just say, okay, let me think about it, because they don't want to admit to you that they just can't afford it. That's why it's important to talk to them. Tell them not only about the options, talk to them about the cost, and then listen. Let them tell you if that's workable for you. You may even want to say something to them like, is that doable for you? And try to maintain the most neutral, right? We talked about being non-judgmental. Say, is this something that you feel comfortable with? Where it's a statement that offers no judgment. That way, again, you gain their trust. They feel more open and are more honest with you because they feel like you're on their side. You may also have those clients that want to do a lot of treatment, and you know that it's not really worth it, and again, knowing who it is, knowing that a little bit about the client, maybe it's a senior and this little fluffy dog is the only thing they have left. That's when emotionally they may need to do a little more. So you may want to work with them that way. If when you can come up with that common goal medically, emotionally, and financially, you're going to find clients who are going to be open with you. You can have a trustworthy relationship. And again, it really benefits all of you, including the pet. That's really who it's helping the most. we are going to spend some time talking about the euthanasia experience. But before we do again, I want to just stop to see if there are any questions or any thoughts.
No questions for me at this
No.
time. It's all good.
You know, I did want to say to Jesse, when you said you've seen a lot of confusion, you know, I just remember from personal experience when my last dog that was diagnosed with cancer, as soon as the vet says the C word, your head
Yeah.
literally starts buzzing. I mean, honestly, my head started buzzing,
Yeah.
and that's shock setting in. And um, and I don't remember what he said afterwards. So yeah, that's it is. It just it's such a visceral reaction to that that diagnosis in particular.
Yeah.
But
Yeah.
you know, it's yeah, you really it's a hard thing to survive.
That is.
And again, I'm gonna just share with you today a little bit of what happened here. And again, I mean, here I am, like in this field. So many of my colleagues are in the veterinary field, and I brought Jeter in for his checkup, and he had this little bump on his ear, right? And the vet said, "Oh, well, that's like a mast cell tumor, but you don't have to worry about it." And I'm like, "Wait, do we have to remove his ear?" And she's like, "What?" I'm like, "Well, I don't want it to grow. Should we take his ear?" She's like, "No." But
I
again,
mean, you don't know. Yeah.
this is what I'm saying, right? Because
Mhm.
like she was explaining to me, mast cell tumors in cats are somewhat common on their ears or their tails. It's more serious, like with a dog, is what she
Yeah.
was telling me. And it's this tiny little thing, and we're gonna monitor it. But I hear the word tumor, and it's
Oh
like,
yeah.
oh, that's it. That's all you needed to say to me, boy. And I should know part of, like kind of where you were talking about with that therapist. We know, right? I could tell you all about anticipatory grief and senior pets and dealing with all this. But boy, it happens to you where you hear like the C word or tumor, and it's like, what? It's like
Oh yeah.
you're a little baby. Nothing matters.
Right.
Maybe.
Right. It is. It's true. It's a constant check for me in my with my when I see a dog and I've noticed a little fatty lipoma, like just the little fatty tumor, which is truly nothing. And I won't have clarified whether this is the client's first dog or first experience, and I'll simply say, "Oh, just a little fatty tumor, no big deal." And they hear tumor, and it's a constant reminder. I do always I try to check myself, but every once in a while it just kind of flows out. Forget I forget that what I know isn't. We all know different things.
Right.
Um, but yeah, absolutely. And I think and you reminded me. I do when you were saying before about making it personal and everything. I do always ask at the very beginning of every euthanasia appointment, because I don't always know my clients for the euthanasias, if this is the first time making this decision, if I don't know them. That's usually how we first start talking about the medical side after we've met each other and introduced ourselves and everything like that. That's usually how I start the conversation, and it is very, very helpful because people are very open. Just like you said, my parents always made the decision, or this is my first time with my own pet, or this is my 20th time.
Yeah.
Yeah. Yeah.
I'll just tell you one of my clients in the group a couple of weeks ago, and this was a woman, and she told me she was 61 years old, and she had never had to make that decision before. Her parents did it first, and then her husband did it for a while, and she just lost her husband 4 or 5 years, and she still had this dog, and all of a sudden now it's her, and it's like, what do I do? I have never been through this before.
Yeah.
So even like you would think somebody that age, most likely if they're a pet lover and have pets before, they weren't, but she really never had.
Wow.
Boy, and that's the time we wish we had our parents and they could make.
Yeah.
Right.
Oh, you want someone to
Right.
step in and be the adult. It's just,
I know.
yeah, yeah.
Somebody
I
else.
tell you, I think we deal, I think, and Sandy, you can correct me if I'm wrong, but I think we deal with euthanasia remorse the most.
Yeah.
I think that's the most common emotion that's really holding people back is the guilt over euthanasia remorse.
Yeah, and you know what really helped me? Because I felt that way with Mars, right? Um, and again, Mars was actually the first time I had to, and so I was
Yeah.
like 30 at that time, or yeah, about 30.
Yeah.
He was mine.
No wonder you were a mess.
Yeah.
Yeah.
But I remember I went to the group, and one of the things that the pet loss specialist said to me, because I said I killed him, I made the decision to kill my cat, and she said, no, the cancer was killing him. You made the decision to end the suffering.
Hmm.
And that really stuck with me, the way she said it. It was like he was gonna die. And she even said, if he was out in the wild or a feral cat, he would have died because he had cancer. But he probably would have suffered a lot because nobody was taking care of him. You
Yeah.
made that decision to end the suffering. So
That's beautiful.
Yeah, and I still say that to my clients and to our chatters.
Mhm.
'Cause it's true, you
yeah,
know, because we do get a lot of that. I killed my dog, I killed my cat, you know, and yeah, it's a tough one.
yeah.
That's a
And
beautiful way of
we all get fatty lumps, you know, as we get older. So
Yeah.
that's what I tell my dog. And after you've had one or two old dogs, you know what a fatty lump, and you can pretty much diagnose it by yourself, you know.
Exactly.
So,
At
yeah,
this
we don't worry about that too much.
Amazing.
All right, well, let's get back. We are going to spend a little bit of time talking about the euthanasia experience. And I know you probably have more experience than we do in this area, but hoping some of these thoughts will help you as well.
Absolutely. I always love hearing new perspectives.
So when it comes to the euthanasia, I mean, like we've been saying, it is the most difficult decision a pet parent has to make during their pet's life. You, as a pet loss specialist, as a veterinarian, are really there to walk with them, help them make the best decision for the pet. Because you need to remember it really is all about the pet. For pet parents, I always try to share with them, right, that it's the most unselfish decision they're ever going to make because they're really not thinking about themselves. They're thinking about the comfort of the pet, and that is our job. And here too, I will share with you, I will never forget. I had a client who had this beautiful little Sheltie named Lucky, and Lucky was a senior. And I was kind of working with her probably the last few months of Lucky's life, and we found a in-home euthanasia vet when it was time that she would be able to call. And one day she called me and she said, you know, Lucky, he can't really get up. I know it's time now. And we had the quality of life scale we were using. So she made the decision, and the vet was going to come that afternoon, and I was going to meet her there at her home. And I said, I'm going to be there for you. And she said, yeah. And she said, you know what, Sandy? She's like, I know I'm making the right decision for Lucky. And I know today's the day that his suffering ends. and mine begins. And that has always stuck with me the way she put it. I will tell you too, and I always share with pet loss specialists, that you never want to make the decision for the client. We provide them with the resources. I will tell my clients, for those of you who are veterinarians or vet techs, that I think it's okay to ask if you're comfortable, like, what would your veterinarian do if it was their pet? Sometimes that'll help too, to hear that perspective. But you're really kind of walking alongside of them rather than actually making the decision for them. I'm gonna talk about a lot of different considerations. That euthanasia experience is, whether it's your first time or whether you've been through it before, I think it's always such a scary time. And it is an experience that will stay with you for a time afterwards. A lot of people, as we've shared, if you've been working in the vet field, you may be more experienced. You may know more of what happens and how it happens. And it's really easy to forget that clients don't know. And so this is a first for them. And I'll share this little experience too. I had a client of mine who just would not even consider the idea of euthanasia because she had been told by a friend of hers, and we know that sometimes friends can be the worst people to talk with, that when a pet is euthanized, it's really like they have a heart attack. It's like this big boom, and then they're gone. And I could not get that out of her mind until she agreed to talk with a friend of mine who was a vet tech. And we actually had a 3-way conference. This was before there was Zoom. And she actually talked to her and was able to answer all the questions. But that's what I'm talking about. She really thought that they were given this injection and it was like this heart attack, that they had. And sometimes they gasped and then they just died. And she didn't want to go through that with her pet. That's why when we can walk beside our clients and answer their questions and kind of allow ourselves to step a little bit into their shoes. The more you know about them, the more it helps. It can make it so much easier for them. When we're talking about the euthanasia, comfort, communication, and connection are essential. Don't be embarrassed if you shed a tear. I really believe, and I think I shared this before, it helps to build that connection. It lets the pet parent know that you care too. During the euthanasia, you want to watch for both verbal and nonverbal cues. Don't be surprised though if clients say nothing at all. Don't be surprised at times if they don't appear to be emotional. Not everyone feels comfortable showing emotions in public. They may get into their car and just be inconsolable, but they have a hard time doing it in the room. So don't look at them negatively if they are holding back their emotions. I will share with you too, a couple, and they were having to euthanize their dog. And they made the decision that they were both going to go. And they were going to go in, and the woman was going to be there when they gave their dog the first sedative. And then she was going to walk out. And afterwards, they made that decision because she knew she was going to be super emotional. And she didn't want her dog to have that last image. And when she went to walk out of the room, the vet tech again, and I don't mean to pick and say everything wrong, and I'll share a lot that's right. But the vet tech said, "You don't want to stay?" And that made her feel worse, but she was trying to do the best thing for her pet. That's why we want to pay attention to both verbal and nonverbal cues. And again, be as non-judgmental as possible. You want to have the whole team be involved. And if you have somebody there who doesn't have the best communication skills, may not be the most compassionate, it's probably not the person that you want to be in the room. But you do want to be able to answer any questions in the simplest and gentlest way. I always recommend, if possible, that when you set up the euthanasia, you do ask your clients, have you ever been through a euthanasia? Do you know what happens? Do you want me to explain what happens? Because the more they understand, the easier it's going to be for them. You want to let your clients know that they're going to have all the time they need before, during, and after the euthanasia. A lot more brick and mortar hospitals, and I really am glad to see this, are now either doing things like using the bill system so that the vet techs don't constantly pop in and say, "Are you ready? Are you ready? Can we come in now? Or can we take the pet now?" I've seen vet tech, I've seen veterinary hospitals that even have a candle that, an electric candle that they have lit on the reception desk, and they have a sign that says, you know, a euthanasia is taking place. Please try to keep your voices down. You want to be sure to ask the clients when they're ready to have their pets be removed, and also be sure the pet is removed respectfully. I will share with you an experience that the woman who started Pet Loss Partners with me had with her own dog, and this was her very first dog, and it was she was, I think, almost 60 when she had to have Jake euthanized. But Jake was a big Siberian Husky. In fact, he is the Husky on the slides next to Maz. That's Pet Loss Partners. That's both of them. So he was more age-related things, and he actually was able to walk into the veterinary practice on his own, and the euthanasia was very compassionate. She got to sit on the floor with him, and she got to have that time when she could say goodbye. And the vet tech came in and said, "Can I take Jake now?" And she said, "Yeah." Well, the problem is that when he lifted Jake up, he didn't support the head. And so as he walked out with Jake, Jake's head was bobbing up and down. And that's the memory that stuck with her. Even though so much went right, she just remembered this poor dog's head like bobbing up and down as the vet tech was taking him out. That just lets you see how a little thing like that can make such a big impression. I'm going to share with you something too, again, in terms of explaining the procedure. So many of my clients do not know that the eyes stay open. I had a client, and You actually are going to read about this in your integrative task, because the examples I use are actually clients of mine whose names have been changed to protect the innocent, so to speak. But she really believed, because her dog's eyes were open, that he was just paralyzed, that he wasn't dead. And in fact, that they were gonna put him in a freezer and then cremate him, and maybe he was still actually alive. Again, those simple little things. It took me weeks to be able to walk her through that. If someone had just explained that to her, it would have made it so much easier. You also want to have policies in place to take care of billing. So if it's a client that you've been seeing, probably best if you can have them pay for the euthanasia ahead of time. If you can have them make those aftercare decisions ahead of time. Again, I'll go back another experience with Maz. Maz was the first pet I had to make the decision for. And after they euthanized, and they did a really good job, but I was sitting in the room, they let me have some time with him. And when they went to come in to take him, and they took him out and they came back in, and they said to me, "What would you like done with him?" And I said, "I want to go with him." I had no idea what they were talking about, right? What do you mean, what do you want done with him? I wanted to go with him. Wherever he was going, I'll go too, right? That's when they explained about the burial, the cremation and stuff. So again, if all those things could be talked about, you also too, in a brick and mortar, and I know you all are in the homes, but if you ever have to deal with a situation, or if you've had to deal with it, we've had situations, right, where I had a client who had to have a very young pet euthanized totally unexpectedly. It was an emergency, and she went in, and she had to, after the whole thing, go out to the front desk and deal with the billing. And there she is crying with all these people, with the young puppies and kids in the waiting room. Again, it just made it that much harder. You want to make sure that the clients are okay. If you're in their home, if there's nobody there, if it's just them, and you're worried about them, ask them, do you have somebody who can come over? Do you want me to sit with you for a while? Better safe than sorry. Is there somebody we can call? Just things to kind of help. But even if they don't need that help, again, it just helps them to feel like you care. Why does all this matter? Again, we did that survey. And this is one of the open-ended statements that one of the respondents said to us, and I think it says it all. They gave us the time and privacy we needed. They explained we were making the right decision, and most of all, they treated us and our beloved pet like family. That's somebody who's going to go back to that practice again. That's somebody who, while sure they're going to grieve, it made it that much easier for them. Here's some other statements that people said at the end when we asked them, is there anything that they'd like to add about the whole end of life experience? And I think it's so important that I just want to read these. So they walked beside me during those last few difficult months. They always had time to answer my questions. They checked in to see how she was doing. Then after we lost her, they continued to check on us. The vet that came was outstanding. He explained the whole procedure. answered all our questions, made sure we had enough time with her. He didn't know us before that day, but made us feel like we really mattered. The card we got was beautiful. Each member of the team shared a special memory. Then we got a beautiful plant with a plaque that we could use in our yard. Again, those are the kind of clients, those are the kind of comments that you want. Those are the kind of clients can still go through a really hard time with the grief, but having that peaceful experience makes so much of a difference to them and then to you too. It lets you walk away feeling like you made a difference. Obviously, to us, the follow-up and pet loss support is really important, and that's what we're going to end with today. But before I do, I'm just going to one more time go ahead and stop the share and see if you had any comments or questions, or hopefully maybe we gave you a few hints that'll help in some circumstances.
You did absolutely, and the you hit the nail on the head with the I comment. It is something that I always wind up saying after the procedure is done, and I don't know why I hadn't learned this lesson in after doing my 1000th one in the home or in the euthanasia, when the owners were like, "Oh, his eyes are still open, her eyes are still open," and I always explain why, but it's not something that I put in my repertoire to explain. I explain everything else, what possibly they could see, sometimes a mild vocalization or something like that, very rare, but things like that. I go into depth about that stuff. I never think to say that the eye is a reflex, or an active process, I should say. So thank you, I for bringing that up.
Yeah, and I will tell you, Jesse, for her, she didn't say anything to the vet at that time. She didn't even ask. And so she walked away, and she really was convinced that this little dog was just paralyzed and now he was going to be cremated and he'd still be alive. I mean, it was horrible. Connie, I don't know if you've ever had any experiences with that or anything else, or
I don't think I've had, I'm trying, see now, because I'm gonna conflate real world with your, your example. Because I'm trying to think if we have. I do know, I know a lot, and this happened to me personally, is when you bring a dog in that, is on death's door that you think, and then you get it out of the car and it jumps up and wags its tail.
yeah.
And so that happened to me with my first Siberian, and so it's adrenaline,
Right.
and so, oh God, we felt horrible. That was, we're taking a perfectly healthy dog in to be murdered.
Mm.
Yeah, so that I remember, I've had a few people like that had that happen, and it's hard.
And that happened too. I don't know if Ellie ever told you, but with Jake as well. Like,
Oh,
he wasn't walking at home, and Howard had to put him in the car and then get to the vet, and he like hops down and
yeah,
went
yeah,
to the vet's office. It's like, oh
yeah,
my God.
yeah. Well,
I feel
and I don't know if this is kismet or whatever, but I just lost a big Siberian Husky named Jake. And
no.
so, that's something that Ellie and I bonded over
Yeah.
immediately. And
Mhm.
I think she had lost her Jake by the time I got my Jake. So,
Oh, okay.
yeah, and my Jake came pre-named. So, but yeah, that was something that we always bonded over. It was Huskies.
Yeah, I
Yeah.
remember that. Yeah.
Yeah.
Jesse, have you ever had any people say, like, question their decision again in a
Mm.
I feel almost every euthanasia, because we do in home, like you mentioned.
Yeah.
And even today's discussion with the client that is in anticipatory bereavement, that needed me to talk to tell her real life. I think the part of the reason why she needed to know the reality of what could happen if she didn't do it is because he was starting to have a good day today. Yesterday was the bad day, and that's when she made the appointment for tomorrow. But today is a better day. And I can tell you, I feel like it's 9 times out of 10 we pull up to the house and they're like, it, they seem to be doing really great today. And we definitely, Connie, we go into the conversation of adrenaline. It's a little bit different for us because we're coming into the home, but
Yeah.
we really brought, like, I'm used to being in clinic and having that adrenaline rush. The way I approach this conversation when I get to the home and they're kind of more active, we talk about clustering good days versus bad days and where we are on the roller coaster ride, and understanding that we have some sort of prognosis or pattern, and we know it's not going to get better from here. My technician and I are very much on the same page, and we present it as it's always good to go out on a better day,
Yeah.
because
Yeah.
On a good day.
on a good day, and very clear about the protocols that we use. It's not the heart attack inducing protocol that you were referencing, Sandra. It's the nice strong nap,
Yeah.
and very smooth movement forward. And so we harp on that. But even with this phone call, she was talking about how he was breathing easier today and acting more. And this, the cat's in heart failure. She also in kidney failure. So she's been giving fluids under the skin all the time. And then as she was talking about it, she was like, well, I didn't give him his fluids yesterday, so maybe that's why he's breathing better today. And I said, yeah, so he's technically dehydrated,
Right.
which is why he's breathing better, but that's not healthy for him in the long term. So you are making the right choice. So yes, short answer, absolutely. All the time we get people, pets having a good day. And I try to reframe that as a very good thing. That we aren't there when the light has left their eyes. We're not there when suffering is all consuming.
Yeah, and I mean, I remember this one vet said this to me, and for me it really rang true, which is like better a day too soon than a moment too late. And unfortunately, with Maz, it was that moment too late. And again, I know it was like that emotional trauma of losing my parents and stuff. But Ma started having seizures at like 11 o'clock at night, and so I had to grab a neighbor, and remember riding like half an hour with him having seizures on my lap, and then like having to give him just like, and now like ever since then I always like, so when Callie died 5 years later and they were gonna try all this treatment, I was like, nope, we're gonna let her go out on kind of on better terms, and not because she hated any kind of treatment and stuff. And
Yeah, yeah,
was
yeah. Quality of life. It's all about
yeah,
quality of life. Yeah.
And yeah, and seizures are a very common barrier or like marker for clients. They are, I've heard it many times, I do not want to see them have a seizure. I do not want to have to see them have a seizure. And Connie, I mentioned,
really
just wanted to say,
traumatic when you see it,
oh yeah. And Connie, I just wanted to say about the Huskies. Cass is the technician that I ride with, who's also in this course, and I think you two have bonded over the Huskies
Oh,
as well.
Oh yeah, yeah, she's got Huskies too. Yeah.
Yes, yeah,
aw.
Yeah. They're a lot of fun.
yeah.
They're
Hmm. All right, well, let's go ahead and wrap up with this. To us, what's a really important part, obviously, is the pet loss support part of it. Okay, so wait, I just want to make sure. Come on, computer. There we go. Okay, so we're going to wrap up by talking about follow-up and pet loss. And obviously, like I said, it's very near and dear to our hearts. I'm going to go back to the study that I sent you just for a moment. And again, in that study, it was 87% of respondents said that pet loss was either very or somewhat important to them. Yet only 28% of the respondents reported that they were offered any type of support. So you could see it's a pretty big discrepancy there. Again, this was several years ago, and I know it has gotten somewhat better in terms of both pet loss and follow-up. But I think, I know, and I've heard this from a lot of vets and a lot of my colleague friends who are in the veterinary field, is like, and I know you all have so much to do when you're in school, and it kind of falls short. It's like taking care of the pets, the euthanasia, and then the other stuff, not so much. But again, it is that other stuff that pet parents are left with, and that's why it's so important to at least have some knowledge of it. Come on. So we shared with you some of the good comments about what vets did right, but we also had some comments like these, and I just want to share them with you so you can see how it makes a difference. My vet couldn't bother to return my 3 calls. Then they had the nerve to send a fill in the pet's name sympathy card. I'll never use them again and have told people about their lack of care. I wish someone had told me about pet loss support. It was devastating and I had to go through it alone. And this one is the one that really got to me. It says, I know we weren't technically their clients anymore, but it was like when our dog died, we died too. I guess I thought they cared more than they did. Those kind of comments are going to be what people share with others about and what your clients walk away with. That's not the experience that you want them to have. I always say that even when there's nothing more you can do medically for your patients, there's still much you can do to emotionally support your clients. I can't tell you the amount of time I have spent with clients who just needed that piece again, not that it was going to fix it, but just needed that support in the beginning, or to have somebody say, myself included, that there is support out there for you. You don't have to do this alone. It makes such a difference. Here's the thing though, and I really try to stress this, and I know you're not brick and mortar, but I still think this information can be helpful for you. Because, and I think even more for in-home veterinarians, it's an option that people feel more peaceful with, right? And I know you actually do more than the euthanasia. And so maybe you get to know your clients more than just the in-home euthanasia vets will. But still, a lot of times it's not the same. And I kind of talked about this at the very beginning of the course. When you're dealing with a vet throughout the whole progression of your life, and then you choose to do this with a different vet, there's not that same kind of, like, you don't know each other as well. You're coming in for a single purpose, and they may not feel as comfortable talking to you, right? It's just the same when you meet somebody. It takes a while to get to know. So when you come in to do the euthanasia, they may just be glad that they have this option, but they may not be completely truthful in how they're feeling or what they need. And like we said, there are some people who are not going to show emotion while you're there. You may walk out and they are just like broken, but in front of you, maybe they're not as comfortable showing that emotion. Whether they show that emotion or whether they don't, though, I think it's important to realize that right after the euthanasia is not the time really to talk about pet loss support. That being said, there's nothing wrong with, and I'll share, when I was in LA, I worked for a large, not for, but with a large veterinary specialty hospital. And we worked with them to create this support folder. And in the folder, it actually had these very nice pins of an angel dog or angel cat. It had our support information, that they were entitled to a couple of support groups, discounted private session. It had a pet loss bibliography. It had coping strategies in there. It had our card in there. Excuse me. And what we suggested that the staff do is, when they walk out, just to hand them the folder and say, we have some resources in here. You may find them helpful. If you need support in here, you may want to take a look at it at some point. And I think that's something that you can do too. And my suggestion is every client should get that, whether they're emotional or whether they're not. Because as we talked about, a lot of times, whether it's just a senior pet or a pet that's been dealt a diagnosis of cancer or kidney disease or heart disease or whatever it may be, there still is a little bit of shock value. You know, you walked into their house and their pet was alive. You're walking out of their house with their dead pet. There is a little bit of a time when the heart and mind are going to have to come together to connect that. And that may take a while. And so by just offering everybody some support and then allowing them to decide if they need it, I can't tell you the number of people who may go home, may, walk out of there, be really upset, then kind of put the folder away. And then all of a sudden, in a few days, they're still not able to get to work. They're arguing with everybody around them. They're losing weight. I mean, I will share with you, I called it the grief diet. Within 2 weeks of losing Moz, I think I lost 15 pounds because I wasn't eating. I just had no appetite. So these things can happen and not immediately. And by offering them the resources, it can really make a difference. Just by saying, like this example here, Mr. Jones, this could be a really difficult time. We want to give you some pet losses that you may want to investigate at some point. Don't hesitate to call us with any questions. We just want to let you know that we're here to support you too. And then let them do with it what they want. I'll share with you another quick story. When I was in LA, I had a man that came to me, and I'm going to guess he was in his maybe early 50s at that time. And he was a high-ranking entertainment executive. And he had lost his dog, and this guy was divorced. And he told his wife, you can have the house and everything else. I just want the dog. And when his dog died, he stayed in a hotel for 3 months because he couldn't go back into his house. But his boss, after about 3 or 4 months, was like, and he didn't know about his dog because the guy didn't want to tell him. Something's wrong with you, man. You've got to get some help. And so he did reach out to our group, to me, and he started coming to the group, and he's like, I didn't know. I didn't know how bad this could affect me. I didn't even know this support was out there. But it had changed everything about his life. He had almost lost his job. And then we're going to talk a little bit about follow-up too. And when I'm talking about follow-up, it's really just kind of both for the benefit of the client, but for yourself as well. You want to be sure that whoever handles those follow-up calls really has a little bit of training and some compassion, right? Like I mentioned that vet tech who went into the euthanasia room. You definitely don't want to get a bubbly, happy kind of person who's just going to go, "Hey, how you doing?" Right? You want to get somebody who can read the person they're talking about. Maybe somebody's taken this class who's able to have some knowledge and offer the proper support. We recommend waiting at least 10 days to 2 weeks after the euthanasia. Again, here's why. Like I said, there usually is that, sometimes we'll call it that grief fog, this sense of shock, trying to figure out what just happened. Again, one day their pet was there, the next they're not, and they've spent all this time with them. Another thing is too, in the first couple of weeks, they probably are getting a good deal of support from family, from friends. At least people are calling to check in on them. But it's kind of like regular grief, unfortunately, even for a human. After 2, 3 weeks, people don't check in on you that much. It's kind of sad, but it does happen. Voice is one of the most important tools, like I was talking about. And here's just an example of something you want to say. "Hi, Mr. Jones. This is blank from BetterVet. We just wanted to check in on you and see how you're doing. We know this loss can be so hard, and we just want you to know we're here to help you get the support that you need at this difficult time." Just something super simple and easy. Doesn't have to go into a lot of detail. The person on the phone, something really important, unless you're trained in pet loss support, the job is not to counsel or give actual support and strategies and kind of work with the client during that follow-up call. It's really just to check on them. That being said, there's nothing wrong with normalizing your client's grief, right? So if they say, "It's been brutal. It's so hard for me to get up and go to work," there's nothing wrong with kind of saying, "Of course, you had such a special relationship with Scotty or Fluffy or whoever you want to use there," right? Again, self-disclosure can be really helpful when kept to a minimum. The follow-up representative is going to want to have those pet loss resources available. The bibliography, recommending a good book, having a pet loss specialist that they could refer to. And it really is okay to suggest to your clients, we do have this pet loss specialist that we work with. Would it be okay if I gave them your name? Or do you have their information so that you can reach out to them? It does make a difference. We've seen so many of our clients benefit from getting support. Something simple like that. Again, the follow-up call is not meant to be a long, extended conversation. It really is just a check-in. I always add this because I've seen some really good experiences and some really bad experiences. And where we talk about follow-up, you should wait maybe 10 days, 2 weeks. The cards can be sent out during that first week of the loss, you always want to avoid the fill in the blank cards or those, pet loss cliches. Oh, Fluffy's in a better place. To that pet parent, no, he's not. The best place is with them. If possible, have the people who actually worked with the pet sign the cards. Nothing wrong with sharing a special memory if you've worked with the pet, even if it's something like it is so clear what a bond the two of you have. And then again, in the card, nothing wrong with putting in the pet loss resource. So we'll come to the final thought, and I think this really says it. Treat others the way you want to be treated, right? If you could remember when we talked about you're the expert experience, if you could remember what it felt like, and you could remember what you need, and give that to your client, it really does make a difference. So I'm gonna stop one more time, see if there's any questions, comments.
Nothing for me. Thank you.
Okay. All right. So before we wrap up then today, I just want to make a note, like I said in the email. So this week's assignment is a little bit different. You have the quiz that you normally do. You have the module task that is somewhat similar. It actually has to do with you're the expert experience that we worked with a little bit during the webinar tonight. And then you have the integrative task, which kind of is like your final exam. So the integrative task is open everything. You go back and look at the webinars. Module 6, really important, communication techniques. Possibly, depending on what situation you choose, you have 2 options you could choose from. Module 2, the anticipatory bereavement. But really what it does is it helps you take everything that you learned and kind of figure out, what would you say to somebody? How would you support them? Okay, we do that to help you get an idea of what you're going to be working with. So you do have more time to do that. It's not done, not due to 10 days. So kind of spread it out. A lot of times we have our students maybe do the quiz, and then a couple of days later work on the module task, and then start on the integrative task. If you have any questions at all, please feel free to let us know. You can email us. I don't have to be the one to answer you. Connie, Sharon, Ann can answer you. They all know what I know at this point with it. So feel free to reach out. Connie, do you have any suggestions, hints, things I left out about that, or?
No, just when we have in the integration task, think module 6, go back to module 6 and and see what the right answer is if you don't know it. So we have a lot of hints in that, because it does integrate a lot of what you learned in this course.
And then just the other thing we really say, and it's going to sound somewhat simple, but sometimes people don't do it because they get an idea in their head and they want to say what they want to say, but then they don't really answer the question. It's like, so make sure what you're writing is actually answering the question. So if we ask for 2 examples, be sure you give us 2 examples, right? So just be sure before you turn it in that it does answer those questions. And again, any concerns, any questions with that, just feel free to let us know. Okay,
Awesome. Thank you so much. This has been amazing.
good, thank you.
Is that a Christmas tree behind you?
I realized when I turn my camera on, it looks like it, but it's not. It is a mushroom tree for spring.
Oh, interesting,
Do
okay.
you keep it up all year and decorate it with different? My aunt does that.
My husband does, and it doesn't stay up all year. It goes away after this, and that's very
Okay.
important that it goes away after this.
I like it.
Thank you. It is cute. I like the mushrooms.
All right, well, have a good evening. Connie,
Thank
if you could just
you.
stay with us just for a few minutes.
Yeah, you betcha.
All
Thank
right.
you both. Have a
All
great one.
right, have a
Bye. Have a
good
good
one.
one.